Hi there, welcome to this week's tip of the week. I'm Dr. Meagan von Holtz. Many of us are preparing for Thanksgiving, if not for the cooking and cleaning, at least for the eating. So I thought today it would be fun to go over some natural ways to try to combat reflux disease and hiatal hernias. Now, are they the same thing? No. But a lot of times hiatal hernias can actually cause reflux. So sometimes if you're talking to someone about them, they'll be asking you questions about both. If we think about the anatomy first, the diaphragm is right about here, and that's the muscle that's involved in breathing. Your esophagus, the food comes through here, and right underneath the diaphragm is the stomach. So those three organs that have all the muscle, they're involved in reflux and hiatal hernia. So if we start with reflux, if you get it, it has symptoms of feels like acid or burning in your chest. They usually say if you get these symptoms twice a week, they can actually officially say you have GERD, which is gastroesophageal reflux disease. That's why they call it GERD. So with that, what happens is there's a muscle at the bottom of the esophagus called the lower esophageal sphincter that should close after the food goes through into the stomach. But sometimes if there's a lot of food going through or the hernia is pushing up, the sphincter doesn't close, so it can allow acid from the stomach to come back into the esophagus, create that uncomfortable burning. One thing that I've found with many patients that can actually work naturally is trying to use some kind of natural acid. One thing is to use apple cider vinegar. So 15 minutes before you eat, put about a tablespoon or two into maybe 4 to 6 ounces of water, warm water, and drink that slowly. Now, if that's not your cup of tea, you can try lemon. The idea is just to add some natural acid, which in your body actually alkalizes, and that can help. The only time you don't want to use those is if you have an ulcer. You don't want to add acid to that burn. The other thing actually that a lot of times seems counterintuitive is sometimes people who have reflux, their stomach is not digesting well enough. It's like there's not enough acid, and that's why it's happening. So for a lot of patients, we actually prescribe digestive enzymes. So those are some natural options. In terms of the hiatal hernia, so that is more the stomach is protruding or pushing up through the diaphragm in a hole there, and that can actually, that's why it can actually cause the reflux too. Hiatal hernia, this sounds funny, but it actually has worked in several of my patients. What you actually do, right when you get up in the morning, you're going to drink 6 to 8 ounces of warm water. Now, coffee and tea, I know I love them, they don't work as well. Just plain warm water. Drink it down, and then, this is what I said, it looks funny, you're going to stand up really tall, just take some deep breaths in and out, and then when you're ready, come up on your heels and then come down hard. And do that maybe, 3 to 10 times. You're not trying to hurt your back or anything. What's happening is the warmth of the water is going to relax the stomach muscle. And then the weight of the water can actually pull the stomach down, that protrusion down out of the diaphragm. Now, I've also read the third step of that is to bring your arms up really high and take several breaths in and out, almost like you're panting. And supposedly that's also supposed to help bring the diaphragm down. I've never tried that part with patients, but I just read that recently, so you could try that too. You're never going to hurt anything doing this, so it's worth a try. If that doesn't work for you in the office, some of our chiropractors are actually trained to do a soft tissue manipulation where we can actually try to pull the stomach down by touching tissue that's adjacent to it. There's also a procedure that some chiropractors know how to do called the diaphragmatic pump, which is an adjustment that you do with a special breathing exercise that can actually change the position of the diaphragm, and it's a large muscle, so it can have scar tissue in it, and if we can get that more supple so it moves better, sometimes that will help as well. So these are some natural tips for you before Thanksgiving. I hope you have a great one. Thank you for joining us. This was Dr. Meagan von Holtz with this week's tip of the week. Thank you.